I don't know how the, is this on now?
Just have it closed.
All right. All right. Thank you, Madam Chair and Ranking Member Dreyer and members of the committee. Thank you for the opportunity to testify on this legislation today. The American people have spoken. They don't want the federal government involved in their personal health care, and they don't want a bill that spends over $1 trillion, raises more than $500 billion in new taxes, cuts Medicare by more than $500 billion, and increases Americans' health insurance premiums. Yet that's exactly what will happen if the House passes the Senate Democrats' health care bill and the reconciliation bill tomorrow. The American people have rejected this bill precisely because it taxes too much, spends too much, and increases premiums too much. With a total of $569.2 billion in new taxes, these bills represent the largest single tax increase in American history. Just what are those taxes? They are a first-time ever tax on health care benefits, commonly referred to as the Cadillac tax, which raises taxes on the American people by $32 billion, but that will grow rapidly over the next decade. A new Medicare tax on wages, self-employment income, and certain investment income that increases taxes by $210.2 billion. A new tax on health insurance providers, which will undoubtedly be passed on to consumers in the form of higher premiums, and totals $60.1 billion. A new employer mandate tax that will crush small businesses, reduce wages, and kill American jobs by directly increasing taxes on employers by $52 billion, and indirectly by much more, as employers are forced to spend even more than they do today on health benefits, even though unemployment is already near 10%. A new tax on drug manufacturers, importers of $27 billion, which will be passed on to consumers. A new tax on medical device manufacturers and importers of $20 billion, which will also be passed on to consumers. New requirements on information reporting on payments to corporations that raises $17.1 billion. A new higher floor for medical expense deductions for people with high medical bills that raises $15.2 billion in taxes. A new individual mandate tax which forces Americans to purchase health care they don't want and can't afford, or else pay this tax. This raises $17 billion, and an earlier analysis of this provision by the Joint Committee on Taxation said nearly half of that will be paid by Americans earning less than 300% of the federal poverty limit, which is $66,150 for a family of four. This, like many of the other provisions in this bill, and ones I've mentioned already, clearly violate the President's pledge that no family with an income less than $250,000 would pay higher taxes. There are also new limits on flexible spending accounts and cafeteria plans that raise $13 billion in new taxes. There's an elimination of the deduction for expenses allocable to the Medicare Part D subsidy in order to raise tax revenues by $4.5 billion. Other restrictions on health savings accounts, health reimbursement arrangements, and flexible spending accounts increase taxes by $5 billion. There's even a new set of taxes on tanning services to the tune of $2.7 billion, a limit to the deductibility of compensation paid to employees of certain health insurance providers that increases taxes by $600 million. And I realize to some that may seem a small number, but it was refreshing to mention one that was in the millions instead of the billions. But that's not all. There's a modification of Section 833 treatment of certain health organizations that raises $400 million in new taxes. These bills deny the use of the so-called black liquor for cellulosic biofuel producer credit, which raises $23.6 billion in tax revenues. There is codifying of the economic substance doctrine that increases taxes by $4.5 billion. And the Joint Committee on Taxation tells us there are other quote-unquote revenue offsets to the tune of $60.3 billion. And again, these 20 different categories of tax increases total $569.2 billion. Now, these bills cut Medicare by nearly the same amount, a whopping $523.5 billion in cuts to a program that provides health care to our nation's elderly and the disabled. And the Senate proposed cuts that were 12% smaller in Medicare. The president's own Medicare actuaries predicted, and I'm quoting from their letter, that, quote, providers might end their participation in the program, possibly jeopardizing access to care for beneficiaries, end quote. But today we're being asked to send to the floor a bill that cuts even deeper into Medicare and the help that it provides. Just what are these cuts? There are $202.3 billion in cuts to seniors' Medicare health plans, including massive cuts targeting the extra benefits and reduced cost sharing seniors receive through Medicare Advantage. CBO, the Congressional Budget Office, predicted a similar policy would result in 4.8 million fewer seniors would be enrolled in these plans in 2019, while the Independent Medicare Advisory Commission predicted a similar policy would result in 1 in 5 seniors no longer being able to enroll in Medicare Advantage as a result of that policy. $156.6 billion in cuts to inpatient and outpatient hospital services, inpatient rehabilitation facilities, long-term care hospitals, inpatient psychiatric hospitals, skilled nursing facilities, ambulatory surgical centers, hospice, ambulances, dialysis facilities, labs, and durable medical equipment suppliers. $39.7 billion in cuts to the home health care providers. $22.1 billion in additional cuts to hospitals by slashing reimbursements designed to assist hospitals that serve low-income patients. $20.7 billion in cuts to the Medicare Improvement Fund, which had been intended to fund improvements to seniors' Medicare benefits, not to finance a new entitlement. $13.3 billion in the yet-to-be-determined Medicare cuts from the hands of an unelected federal board. $2.3 billion in cuts to imaging reimbursements when seniors have MRIs, CT scans, and other procedures. $800 million in cuts to power wheelchair suppliers. $65.7 billion in money taken from seniors in the form of higher premiums and additional cuts to Medicare beneficiaries and providers. The $569.2 billion in new taxes and the $523.5 billion in cuts to Medicare to fund a new entitlement program are unacceptable, especially when you consider these bills will increase the deficit once the cost of the Medicare doctor fix is factored in, and that will increase the cost of health insurance for all Americans. Simply put, the Democrats' bill will not only ruin our health care, but the tax increases will ruin our economy. Madam Chair, I'd like to close by just making a few simple requests. First, I urge you not to make these bills in order. They're deeply flawed, and they ought not to be brought to the floor for a vote. But second, if you insist on making them in order, I ask that you wait until we have the missing but very critical information that we need about them, such as the impact on health insurance premiums and national health care spending. With respect to both the Senate bill and the one the House passed, the Congressional Budget Office agreed both would raise the cost of health insurance. And the Medicare actuaries agreed both would increase national health care spending. But today we're moving forward without the review and the written letter from the administrations of the President's own actuaries, the Medicare actuaries who are charged with evaluating the impact legislation like this would have on Medicare. So before we vote on these bills, I think we ought to know if the quote-unquote fixes that will be passed potentially in reconciliation have worked, or if they'd made the situation worse. And third, if you insist on moving this to the floor for possible consideration tomorrow, I request that you not use a so-called slaughter solution and instead allow a clear and clean vote on each measure. The American public deserves to know where their elected officials stand and not to have them hide behind a procedural vote. Thank you for the opportunity to testify today.
Thank you, Mr. Camp. Now we'll have the distinguished